Hello, Dr. Hashmi here. I'm a psychiatrist. This video is about care home selection. If your loved one is taken into hospital for some reason and the hospital staff advise you that your loved one cannot return home and you are put in a situation to select for a care home, before going into the selection of the care home, you have three options to consider. And you must consider all three options for your loved one. Number one, look at option whether your loved one can return home with additional support. Because local authority has the resources to provide you additional support subject to an individual's need. Number two, if your loved one will be a self-paying individual, like paying from his or her own pocket for care, consider home care option. Because if you take your loved one back to the same environment where they actually taken into hospital from, their mind will not get into a lot of stress of learning new information. And the quality of life remain better. Their ability to operate will be better. Change of environment means you might end in seeing quite rapid deterioration in the first few months after somebody is taken into care. So bear in mind, returning home with additional care is always a better option. Number two, have you looked into live-in carers? If you look at the financial side of it, live-in carers and care home, there is not much difference between the spending. A lot of people don't know about it. If you hire somebody, and there are plenty of businesses out there which provide live-in carers, live-in carer option is not a bad option if your loved one has a spare room and somebody can live with the loved one to look after them 3-4 days at a time, and then there is a change of carer, and then again. So week is generally divided into two carers living in with your loved one, looking after and doing everything for them. That is also a very, very good option. The third option is selection of the care home. Now I have done a separate video on selection of the care home. But when it comes to selection of the care home, three most important things you need to keep in mind is location of the care home should be accessible, easy, parking, all that stuff, the practical aspects. Number two, the staff, how much is the staff knows the residents already in that care home. Number three, level of staffing at night and the proportion of male and female staff at night. That is integral and very, very important. Number four, duration of staff employments. A care home which employs staff and they've been working there for 10-15 years, absolutely it's a wonderful care home. Good care homes retain staff. Thank you very much. Problem solving in a family and a group setting. I have done videos for individual problem solving. This is for group and family. Now, in a group and a family situation, you have to identify the problem jointly. You need to discuss the solutions and pick the three best solutions and then agree on one. And once you have agreed on one, you just need to implement it and review the results. Very, very simple way of doing it, because when we do things together, we actually feel more encouraged and confident, and we share the strengths of each other. So it's an easy way of doing it. But this is for the families where you see good enough communication, families talking to each other. There are a number of households where people don't talk to each other, and I'm going to do a separate piece of work on it. But these stages are simple stages just to keep in mind for families which are talking to each other. People are talking to each other in a group setting. It works very well.